Thank you very much. Appreciate that.
Oh,
Thank you, Dr. Rich. How are you?
Welcome back.
Thank you.
And one thing I realized, I may be talking too fast. Okay, if I do.
I'll catch up.
Okay, well, they'll just tell me.
Yeah.
You want that? You want to speak? Okay. People see the feed.
I'm good. Are you? No, you're good. You're good.
We got about 2 more minutes, so we'll go ahead and wait, give everybody an opportunity to get here.
I forgot to ask, is it doctor like MD doctor or doctor?
No, I'm a nurse.
Oh, nurse.
What? Yeah, doctor,
Because you
like I
gotta do
have a
that
doctorate.
final
Yes,
Doctorate.
like you would say director too.
Yeah.
We'll go ahead and get started. We want to make sure that we're respectful of everyone's time. And as always, I appreciate you being here to help us get the information out to the public. And I know over the weekend we didn't do our usual Saturday and Sunday updates, so today we have a little bit more information to present. I will give the typical update that I've been doing at 2, and then I'm going to turn it over to Mayor Harris to say a few words. And then we're going to turn it over to District Attorney Wyrick to be able to give some updates from her perspective and to highlight some things that she's doing in her office to fight the COVID pandemic locally. So Shelby County is currently up to 379 cases. So that is an increase, but what we found over the weekend is that our percentage of increase actually was slower than it had been during the previous week. So our positivity rate, which is the number of tests that were positive based upon those that were actually tested, was a little bit over 2%, which is lower than what we had. Now that's fairly early and we don't want to claim any success for social distancing, but we do think that's an interesting finding from this past weekend. Many of you are already aware that we experienced our first death in Shelby County towards the end of last week. Any death is a tragedy. However, we recognize that we are likely to have more deaths in Shelby County just as they have across the rest of the state. I also want to note that what we are seeing is while we still have the majority of our cases in individuals under 60, we're beginning to see more cases in that aging population, which is very important because they're an exceptionally vulnerable population. And part of our purpose of engaging in social distancing is to protect the most vulnerable in our community. And that would be those who are seniors, those who have chronic illnesses of any age, and those who may be immune compromised. We are also currently working an outbreak in an assisted living facility, which then again reinforces the vulnerability of our aging population, and also to reinforce the importance of not going to work when one is ill or not visiting others when one is ill. To date on our call-in line, we've fielded over 1,750 calls, and those continue to come in around an average of 100 a day, but generally on the weekend they're a little bit lower than that. While we have more cases than Davidson County, I still consider Davidson County is part of Middle Tennessee, and so we're probably running neck and neck at this point with the Middle Tennessee region. The key takeaways for today, I really want to reinforce that all of us have something to do. We all have our part to play in reducing the impact of COVID-19 in our community, and the most important thing we can do is stay away from others, really adhere to the stay-at-home orders, to try to avoid places where there are more than 10 people. And I constantly reinforce the importance of hand washing. I can't ever underestimate the role of hand washing. Also, to remember to stay at home if you're ill. If you think that you have COVID or that you've been exposed to COVID, unless you need medical attention, we really are encouraging people to stay home. That is consistent with the CDC recommendations. If you go to a doctor's office and sit for hours, you're exposing everyone in that area, so please stay home. If you need medical attention, contact your healthcare provider first. And then if you are exposed to someone who's been diagnosed with COVID, you should be quarantined for 14 days. And quarantine means that you remain home. No one comes in and out, and no one new comes in and out of your house. Those who live there can. And you might be able to go in your yard, but you really can't engage with other people. And I'm reinforcing those messages because we're continuing to get feedback that people are not adhering to isolation and quarantine. So I think everyone's trying to do their part, but I'm going to reinforce that we really all have to do our part. I think having a death in our community highlights the importance of the fact that we all have to take action. We only need to look to New York and New Orleans and see how exponentially this problem is growing. And so I implore all of you to do what you can to protect not only yourselves, but your families and the communities. So I'm going to turn it over to Mayor Harris for a few words, and then to Ms. Wiley.
Well, good afternoon. We are saddened by the death in Shelby County, our first death, which was reported over the weekend. I believe that it shows how serious the novel coronavirus is, and that we have to continue to drive a message that encourages social distance, that encourages employers to create alternative work solutions so that employees can work from home, and we have to continue to try to expand our testing capacity. I'll mention that we're also going to have commission this week. So we have commission on Wednesday, and in commission we will be driving a conversation around this public health event and how we confront it. One of the things we'll be bringing to the commission is opportunities to raise public awareness around social distance and its importance, and asking the commission to support an investment in a public awareness campaign. At the same time, we'll be discussing the economic consequences of the current environment that we are in, and the need to make sure that Shelby County is investing in the social safety net and expanding our social safety net. So that's one of the core responsibilities of Shelby County government, and most of that is housed within our CSA, Community Services operation, and we have a real need to make sure that that operation is prepared for the economic consequences and the dislocation that we expect to be coming here soon. One of the other things here, and this is in order to introduce our guest today, District Attorney Amy Wyrick, comes by way of a recommendation from the Health Department and also from an order from the Tennessee Supreme Court. They have requested that we make efforts to reduce the jail population. Many of the folks that are detained in our current jail population are vulnerable because of pre-existing conditions to COVID-19, and because of the structure of detention, spread is very, very possible. And so this is work that we've been working on anyway, reducing the jail population for many, many months with lots of partners, and District Attorney Wyrick has certainly been one of the most important leaders of that work that has gone on with many partners. Our social justice partnership that's gone on for many months with social justice partners and the MacArthur Foundation. So District Attorney Wyrick and the sheriff, of course, and the criminal court clerk, and lots of other real leaders have played a role as we have tried as best we can to reduce the jail population. We've had great success. And so I'll leave some of those points to be made by our district attorney. And so with that, I welcome Amy Wyrick to the podium. Thank you.
Thank you, Mayor and Dr. Househalter, for all that you and your teams are doing during this stressful time for our community and for the nation. So let me talk just a little bit about the most recent order from Chief Justice Bivens of the Tennessee Supreme Court. The Supreme Court has ordered that all out-of-custody court dates in the month of April not happen. So there will be no more out-of-custody court hearings until April 30th. That also means that there will be no jury trials, and we are working on whether or not we're going to be able to convene a grand jury to hear cases that have been held to the action of the grand jury, but that is to be determined. But any and all defendants who are out of custody and have a court date in April should be on notice that that will not happen. And that is going to help us eliminate, or reduce rather, the traffic in and out of 201 Poplar. So what we want to be mindful of through this crisis, as we are every day, are the victims of crime. The DA's office is still open, the criminal courts are still open, and the general sessions courts are still open. But all that we are handling are cases involving inmates who are in custody. And we are handling those cases where the resolution might be the release of that defendant into the community. Speaking to the mayor's point about the Chief Justice asking all of the judicial districts across the state to do what they can to reduce jail population, as the mayor mentioned, a lot of that work has been already going on here in Shelby County. The judicial commissioners, as well as pretrial services and all of our partner agencies, have been using a new assessment tool so that we can make sure that the people that are in custody at 201 Poplar, awaiting resolution of their criminal case, are the worst of the worst, are the most serious offenders. So we had already started working toward making sure that what everybody likes to call those low-level offenders, they're not in our jail anyway. And law enforcement for many, many years has used a misdemeanor citation, which is a piece of paper that is given to a defendant telling that individual that they are not being arrested at the moment, but that they should come to court at a later date and have their matter handled. So that issuance of the citations that we have used for many, many, many years has helped reduce the number of inmates being booked into the jail. The new PSA, the public safety assessment tool that the judicial commissioners and pretrial services is utilizing, has also been cutting down on any of the low-level offenders that might otherwise be in custody. So a year ago, January 2019, we had almost 3,000 people in the jail. The beginning of this year, January 2020, we had 2,600 people at 201 Poplar. As I stand before you today, we are right at 1,900. So much of that chipping away, as I mentioned, had already been taking place. What the DA's office has been doing over the last 2 weeks, working with the criminal court clerk's office, working with our judges, and working with our public defender's office, is to quickly identify any and all inmates who are in custody who have already indicated a willingness to plead guilty, right? They've admitted their guilt, they want to handle their case and be done with it. And if they were to plead guilty to their case, it would mean that they would be released from custody. They've been given an offer by us saying you'll be let out. So we have quickly identified those cases and eliminated a lot of the hurdles that otherwise exist in the system. So taking what would have amounted rather to weeks and maybe months to dispose of a case, we're turning those around in just a matter of days. The other thing that we are doing is sending out letters to literally hundreds of individuals who have been charged with a crime, who are out on bond, and if we've reviewed their case and determined that it's not something we're going to prosecute, driving on revoked is a good example of that. If we've reviewed it, we're not going to prosecute it, they're getting letters from me. A letter that says, do not come back to court. This particular case has been reviewed by the DA's office and we are not going to prosecute it. To date, we have sent out over 500 of these letters. So anybody out there watching this, if you get a letter from the DA saying your case has been dismissed, it's not a joke, we mean it, and we're just trying to eliminate the foot traffic in and out of 201 over the next coming weeks and months. Last but certainly not least is the importance of remembering victims. As I started to talk, I mentioned that that is in the forefront of everything that we do in the DA's office, our duty to victims. What concerns us today is that home for many people is not a safe place. The Department of Children's Services is already reporting that their number of referrals has been reduced drastically over the last 3 weeks because they rely heavily on teachers to report suspected child abuse. The teachers are no longer seeing their kids every day. This is a good reminder for the public that every adult in this community has a responsibility to our children. If you suspect anyone is being abused or neglected, either our children or a vulnerable adult, you have an obligation under the law of the state to pick up the phone and report that, to call DCS or to call Adult Protective Services and make sure that information is shared with people that can do something about it. The justice system is still open for business. Victims still deserve and will get every protection that we can provide them under the law. And the last thing that your DA's office wants to do is to substitute one danger for another. And so the cases that are in custody, the cases that we are focusing on, are those people who have committed violent crime in our community. And we are working hard to make sure that we identify those that we can safely, responsibly, and reasonably release into the custody of the community. But again, just want to remind everybody that the services are available. The doors are open at the Family Safety Center, Child Advocacy Center, the Crime Victims Bureau, and other agencies in town to help our victims of crime, who we can't forget during this time.
If you want to stay up, I think to make it easier for everyone, if you have questions for District Attorney Wyrick, ask those now, and then we can ask the mayor up. You can ask him, then I'll go last. Do you have any questions for District Attorney Wyrick?
I do. What about unintended consequences of saying that those that are likely to plead guilty? Do you fear that people will feel a pressure to feel guilty without realizing that
No.
might carry them around, the consequences of
And
a
I
guilty
probably
plea?
didn't do a good job of explaining it. These are individuals who had already said, I'm guilty. And so we had continued their case to get it into the criminal courts. Even though we're all in the same building, the general sessions courts and the criminal court clerks, your head would probably explode as to how long it can sometimes take a case to get from the basement, right, up to the criminal courts. We've cut down all of those barriers. So these are individuals who had already said, I'm good for this, I did it, I want to plead guilty and take the state's offer. So what would have maybe taken weeks to get done, we're doing it now in a matter of day or days. Yeah, good question though, thanks.
Amy, what
Yes,
about
ma'am.
sex offenders? Are they in that list of people who are being encouraged to plead guilty and leave?
Well, no, we're not really encouraging people to plead guilty and leave. What we're doing is looking at everybody that's in the jail, and the first kind of, to overuse an overused phrase, the low-hanging fruit of those individuals who had indicated they were guilty, they wanted to take their offer, and the offer that we had given them was probation, right, or time served. They've been in for this amount of time and let's get them out of here. Those cases are the ones that we zeroed in on first and got that turnaround time, got those barriers eliminated so we could speed that up. Now we're going back and looking at every case that's in custody to see if there are any that we could safely, reasonably, and responsibly make a different offer on, or perhaps agree to upfront probation. The issue we have, and you raised the point, is most of the people that are in custody are there because of violent crime. They're there because they have victimized somebody in our community. So no, we're not releasing masses of certain types of offenders by any stretch of the imagination, and have really been deliberate. Our team has worked around the clock to make sure that we're identifying the appropriate offenders to safely release into the community and avoid having to just release masses of a certain type of offender. Because again, the people that are sitting at 201 Poplar have committed violent crime.
Any other questions for District Attorney Wyrick? Any questions for Mayor Harris?
Yes, I have one, Mayor Harris. So yesterday, Mayor Harris, the Trump administration announced the social distancing for them recommended to April 30th. I know some of the safer-at-home orders are, in effect for the next couple of weeks. Do you anticipate the municipalities, you countywide, pushing these recommendations more to April 30th to follow the White House?
So we have agreed to review each of the executive orders once every 7 days. So our last meeting to talk about whether we would renew the executive orders that encourage social distance and encourage the population to limit non-essential activity was Friday. And all the municipal mayors that were on the call Friday agreed to renew those executive orders, renew them either Friday or Monday. And so those will be in effect for another 7 days, and we will review again. So I think our next scheduled discussion of that is coming up on Tuesday or so. And I expect we will renew again, but I don't want to get too far ahead of the process. I think, again, it is based on what we hear from the health professionals and the environment. I, for one, speaking for myself, certainly welcome guidance from the federal level or from the state of Tennessee. I think that makes the efforts at coordination a lot easier when you get that guidance from the federal government or from the state of Tennessee. And so I think that, I'm inclined to defer to the kinds of things we've heard from some of those officials. And just one more word about the jail population. It's important for public health reasons, important for moral reasons to bring that jail population down. It's also important for budgetary reasons too. As the district attorney mentioned, we've had routinely 2,700 folks in the jail, and now we have about 1,900 in the jail today. That's a huge drop-off. Our jail population costs us as a county. I know because I got to try to prepare a budget to around some of these issues. Our jail population costs us $100 per inmate. So it's over $100 million, $100 per day, $100 per day per inmate. So you can do the math. When we had 3,000 detainees times $100 times 365 days a week, 365 days a year, is over $100 million in spending. So $100 million in spending just for one operation, one detention facility. If we bring those numbers down, it could make sense and help us to improve public health throughout the community. It can make sense depending on what their offense is, but it also saves us real dollars. And so it's important on a whole lot of fronts.
We've seen video of people in large crowds at some of the parks, at MLK Park. What are you guys going to do to kind of put a stop to that? Because there's definitely more than 10 people.
So I think that I don't know if those people know each other. So I'm not sure if those are social gatherings in the same way as a party is a social gathering. I think the important thing is to remain is to encourage people to live up to social distance and the rules around social distance. And I think the main takeaway is that the vast majority of people in our community are really making a sacrifice for their neighbor, for their community. The vast majority of people in our community are really committed to doing whatever they can in their respective corner to reduce spread and to try as best we can to improve the public health. So I think most people are doing that. Are we going to have 100% compliance in a free country? Probably not. But I think we're going to have most people that are willing to be compliant, and most people are. I see my neighbors at home right now, and I think in lots of neighborhoods you have neighbors that are at home and that are trying as best they can to make whatever sacrifices they can to keep people healthy and make sure we have the capacity to deal with the need when it happens.
Are we going to have to shut down those parks though? Because the video circulating with MLK Park, there were just people everywhere. Is it going to get to the point where they're going to have to shut those parks down?
I think that there will be conversations around whether or not to shut down parks if it becomes apparent that the patrons are not observing social distance and there's a risk to public health. Yes.
Mayor Harris, you said you and the commissioner are preparing for the economic fallout that the county is going to face, most certainly. What kind of figures are you looking at, though? What kind of modeling? Have you seen anything yet that sort of projects what kind of fallout is a worst-case scenario, best-case scenario? What are we looking at?
So I think it will hurt in terms of revenue. The lucky thing on the county side, a little bit different from some of the municipalities, the county doesn't rely as heavily as the municipalities on sales tax revenue. And so that's where your first hit will occur with respect to sales tax. So if the retail space is shuttered, if people are not going out as much, that's where you take your first hit, and that hit could easily be 20 or 30%, just based on the shuttering that can reasonably be expected. The county relies a lot more on the property tax and fees and fines and so forth. And with respect to property taxes, yes, there will be a hit there. It'll take a little bit longer for that to be realized. I mean, we'll take a hit on property tax collections because some people won't be able to pay and so forth because of dislocation. But for some of the valuation hit to take effect, it'll take a little bit longer for some of the valuation hit to take effect. So our reappraisal, I think, is set for 2022. And so in 2022, I think everyone was optimistic that when we hit a reappraisal, which is once every 4 years, I think everybody was optimistic that we would see increased evaluation and therefore possibly increased revenue for public services. I don't think any of us are assuming that the reappraisal that occurs once every 4 years will lead to increased revenue for local government.
Did you say 20 to 30% of the sales tax revenue or of the county budget?
Oh, of the sales tax revenue in general, sales tax revenue is likely off a significant sum, and I don't think anybody would be surprised if sales tax revenue was off by 20 or 30%. Again, on the county side, we don't rely on sales tax revenue as much as the municipalities. But that's kind of your first slice is what's going on with sales tax revenue, et cetera. And there's a little bit of a windfall because some of us are getting some internet sales tax revenue that we wouldn't ordinarily get. So internet sales tax revenue is expanding a bit, but that's going to be offset by the loss of the sales tax related to retail. Remember, tourism is one of the centerpieces of the economy. 12 million visitors a year in the Memphis metro area. If you get 12 million visitors a year, and now that has all shriveled up, that particular part of our economy, that'll be a major hit to lots of bottom lines. All right. Very good. Thanks.
Thank you. Any questions for public health?
Yes.
Okay.
So can you help us understand what the effect on our hospitals will be from the rural counties where they do not have hospitals or they're very small? How are you planning for that?
So currently, not only at the county level, but at the state level, we're working on what's called predictive modeling to determine how many people we anticipate will need hospitalization and potentially intensive care units. We also know that the state is working across the state, so including with Shelby County, to identify places to really have temporary hospitals so that people can be moved into those to free up ICU beds.
Would they be in tents or convention centers?
They're actually looking at what are hard wall facilities first, but there are field hospitals. We have one available in Shelby County. There's also a very large one in Jackson, Madison. So the field hospital, which are more like a tent, it's a military field hospital, may be an option, but it's not the only option. They're really looking for hard wall space. It has to meet certain criteria and ideally be able to house up to 1,000 beds. So the goal is to have those things available and ready before we have the surge, so that we, again, don't end up like New York where you all of a sudden need beds and they're not available. So there's a lot of proactive planning. You're probably aware at the state level there's Unified Command, and that's a combination of public health as well as emergency management and the military. The military is very good at standing up field hospitals very quickly. That's what they do. And so that combination really assures that Tennesseans will be more proactive in being able to address those hospital bed needs.
May I ask one more question? Can you help us understand where we can find information about how many ICU beds there are in our county, how many ventilators, how many people are hospitalized?
So there is a system called the Health Resource Tracking System, and that's filled out every day by the hospital systems. I will say it's not always 100% accurate. It's really dependent on who fills it out, and that's done statewide. And then the state health department is adding some additional fields. So typically it wouldn't have within the data system how many ICU beds are currently occupied and how many people do you have with diagnosis of COVID. My understanding is they're trying to add those fields today and tomorrow. So that data is available. Once that begins to be fed into the system, we can include part of that in our report. I think what's important to note is that the raw number is important, but it's not the be-all, end-all, because patients can be moved, and people within the hospital setting can change rooms around. So you can create ICU rooms, or you can create negative pressure rooms. It's a barometer rather than a black and white response. But we can begin, as I said, to try to include that within the next week or so. So I'm gonna go around, I'm gonna make my way around, so go ahead.
Alicia, can you tell us about the assisted living facility that you were talking about? Can you tell us where, name, how many patients? And also on that, over the weekend, there was the nursing home in Middle Tennessee where we have 100+ staff and residents with the disease. That kind of dovetails into this, that we're seeing that here too. Those areas are really a concern for you all. So any specifics about that would be appreciated.
I'll give as much as I can without naming the facility, but I'm going to start with, this is what you would expect to see. So if you remember, our initial cases were travelers, and we feel very comfortable based on the data that we have that we picked up those initial cases in Shelby County. And that's really a positive for our healthcare providers, and that those were individuals that weren't in intensive care necessarily. But as we continue to have spread, you expect that you're going to have spread into vulnerable populations, and then what we would call mini outbreaks in different settings. And so nursing homes as well as assisted living facilities are those kind of places where you have many outbreaks. We knew this facility had one case a few weeks ago. We work closely with them as well as the state. They have an infection control practitioner that works with nursing homes statewide that worked with that facility. But once we got record of a second case about 2 weeks later, we've done much more intensive work with them. We did significant testing over the weekend and have gotten those test results back and been able to determine who else is infected, and working with the facility on quarantine and isolation. And then I will really applaud the facility. They have been exercising exemplary infection control practices already, but we just wanted to strengthen those. We've also made sure that they have sufficient PPE for all staff to be able to wear masks.
How many people tested positive?
I can get that number to you. I'll get Joan to get it to you. I don't want to give you a wrong number. I know we tested 22 total. And of that 22, a small number, maybe 4 to 6 are positive, but those were ones that were already positive as well, not new positives.
And why can't you say the name? Other places have said the name.
So we may ultimately release the name. Generally, I like to work with an organization before I share information, and perhaps have them here as well to be able to share their side of what's happening. And so we'll wait, but it's not that I won't ever share it.
Can you say where in the county and municipality, just any identifying information?
Yeah, actually, I won't give the address currently. I can ask Joan to give you a rough area along with the specific testing data that we have. But I also am going to point out what I said. We expect many outbreaks. And I'm going to continue to reinforce the importance of not going to work ill. What we've consistently seen in doing our contact investigations, that people go to work with mild respiratory symptoms. They put them off to allergies or something else, and then they expose others in the workplace. And so that's really critical as we move forward, particularly for those who serve vulnerable populations, those who are healthcare providers or first responders. And then we also have to be attentive to each other so that if any of us are becoming ill, we make sure we're excluded from the workplace as well.
When you were,
I'm going to make my way around and then come back this way. Okay, go ahead. He said for you to go ahead. You can go ahead.
If a business has someone who contracted the virus, let's say it's a grocery store or something like that, should they have to shut down, or what is the procedure to that if you have someone at one of those businesses?
No, typically not. What happens when we receive notice of a case, part of our interview with that individual is what do they do for a living, where do they work. We may also go to the facility to see what that work environment is like, and based on that we give tailored recommendations. So typically it's cleaning the area where the individual works. That should have already been happening, but you also want to reinforce it afterwards. Also understanding who that person had contact with, identifying all close contacts and quarantining them. and then working with management or leadership to do appropriate screening of individuals coming into the facility. So your specific example was a grocery store. If one person in a grocery store tested positive, that would not be a reason to close the grocery store. If we anticipated that they weren't cleaning properly or there were other things in the environment contributing to transmission, then we can make a decision as the health department to order them to close. Did you have your hand up, Emily?
Yes.
Yeah.
With regard to the assisted living facility, did your investigation indicate that a staff member brought COVID into the facility?
So we can't say that for sure. What we know is two things. There were staff members who have respiratory symptoms, but also with seniors, you know, we've talked a lot about COVID having typical flu-like symptoms, including fever. What we all have to keep in mind as we age, we don't mount as much of an immune response, and so our symptoms are not as evident. So someone may not really have a fever if they're elderly. They may have more confusion or some other thing. So it's not clear what came first, potentially that it was brought into a resident there, or if it came in through an employee.
And then you mentioned 4 to 6 positive tests, and I know we'll get those numbers later, but were those residents or?
It's a combination of residents and staff.
Okay. And then I also, if you don't mind, another question. Since we have such a number of cases now, will we get those county-wide cases, will we get those broken out by zip code at any point?
We will at some point when we have a large enough number. And we've been doing some heat mapping really to look at testing more than actually where individuals live. Because what we are not seeing currently that it's a neighborhood cluster. It's really work clusters and travel clusters initially, and we're looking at that heat map really to assess where testing is occurring and not occurring. In order to determine how widespread community transmission may be, we have to have adequate testing from all communities in a representative sample. And we are reporting out a lot of data now that we didn't have 2 weeks ago in the Joint Task Force meeting. And Joan's going to work to upload that data on our website daily so that ultimately the media and the public will see what we're reporting out countywide. It's very similar to opioids. Now that we have the data, we can put it out fairly regularly on the website.
And when
So I'm
would
gonna
we expect to see the zip code data? Or what?
That would be in the mapping, the heat map.
Dr. Hausler, what are you able to say about the one person who died?
So what we can say about that individual is they were older than 60. And as we know nationwide, it's a combination of things that make people more at risk, including age and other chronic illnesses. We also are seeing nationwide that people become ill and deteriorate very quickly. And those are the things that I would say are applicable to this individual as well.
Male or female?
I'm not going to give that information.
Also, as a follow-up, I know Mayor Harris kind of alluded to it too. We saw some pictures taken by others over the weekend of in Harbortown people hanging out in close quarters on a patio, not really disregarding the social distancing. What would be just again your message to? We're seeing these images here and there of people clearly not responding to these recommendations and requirements.
So my main message is that we know social distancing does work. And if we in Shelby County engage in appropriate social distancing, we're not going to have the burden on our healthcare system that other communities are seeing, particularly New York. And we all have a part to play. Whatever age we are, whatever we do day to day, we have a part to play. We encourage people to, as peers, remind others to engage in social distancing as well. I do know, though, that there is also, I'll say, more passive surveillance, but you know, as police officers are riding around, if they see crowds, they're going to mention something. Dr. Randolph and I have talked about potentially what is the role of the health department and actually doing some outreach. As far as businesses, if they're not adhering to social distancing, we can use codes, permits, and other types of leverages to encourage them positively to engage in social distancing. The mayor already mentioned we'll do much more social marketing. And then I always rely on the media to get the message out of how important it is to really adhere to the social distancing message.
And as a follow-up, over the weekend, or starting this week, UTHSC was supposed to have a lot more quicker, test more, being able to test more, have quicker turnaround of results. what impact will that kind of maybe jump the results higher, the confirmed cases higher, maybe not out of sense of fear just because more results are coming in? How do you think that will kind of impact the numbers the next?
So that's always a possibility, but one of the things that's still happening and is important is people should only be tested if they meet criteria for testing. And that means they are exhibiting some signs and symptoms, they've been a contact, perhaps traveled to an area that has transmission, and that way we're actually getting a true sample of those who need to be tested and what their positivity rate is. Over time, some communities are advertising to do mass testing of everyone. That may or may not bear fruit in the long run, and I've referenced South Korea previously. They did mass testing of millions of people, and it did not necessarily change the approaches that they took to reduce transmission. We'll come
Just
over
a
here
few
and
quick-
around, then I'll come back.
Okay, real quickly, can you say if the death was connected at all to that assisted living center?
It's not connected at all.
Okay, and then I don't know if you can say it, given what we said about the other things. We've had reports of cases at a FedEx supply chain as well as a plasma biological center. Have you heard anything about those?
So
Some outbreaks
I
of
won't
those?
mention any businesses specifically. I'm going to reinforce what I've said before. We have transmission in the workplace. And that covers a variety of different work settings. And oftentimes what we found is individuals traveled, and then upon travel developed some early signs and symptoms, and then went into the workplace, and then there was exposure in the workplace. So I would say generally you can expect any workplace could potentially have cases.
The county's been posting testing numbers as of last week. What started this, and then where are you getting those numbers from?
So we've always known we wanted to calculate the positivity rate, but as you have any new illness, and I said this early on, the data streams are not accurate and they may not be timely. And by law, the laboratories only have to report positive findings. So that's what was coming in initially. The state of Tennessee requested laboratories to report all testing so that we could get that positivity rate. And the state got the data first, and they had to make sure it was clean, accurate data, and then they're able to help us look at it at a county level. So that's been the process by which we got here, but we've always known that we needed to get to this particular place. Someone come over here.
Yeah, so there was data that came out of the University of Washington this weekend that's been widely cited. I'm not sure if you saw it, but it does a projection for each state, and it projects which date they're going to have peak resource use. And it projected for Tennessee April 26th. How does that fit into what you're anticipating for Shelby County?
So some of our earlier calculations, and again, these are preliminary, and we're waiting on the state's model. Much of that is based upon whether social distancing is effective or not. So our original calculations were around the beginning of May, but that can be staved off if we take action. And that's the critical takeaway message, is that if we engage in prevention, we can really allay that surge on the hospital and hopefully space out the need for ICU beds, so it's not all of a sudden, within a day or two that all those beds are being consumed by individuals who need them.
Could you speak about the extra hospital resources? Is there a location that is already physically existing in Shelby County that you all have identified, this is our first desire to put in an extra hospital here?
So that decision is not final, but work was being done over the weekend with the state of Tennessee to identify the location or locations, more than one if necessary. And then through the mayor's office, administration has been also identifying places that we could potentially stand up the field hospital if we need to do that in partnership with partners. I'm gonna take her, then come back here to every last one.
Can you talk about the positivity rate going to 2% over the weekend? What do you think happened?
Well, I mean, it was one day, so we could say it's an artifact. That's one way to look at the data. The other is to say we are testing the right people, and that we had less people who were positive on that particular day of testing. Now, what we're really looking for is to get testing across the county so that all communities are equally represented in the testing data. Right now, when we look at the heat maps, it's more affluent communities that are being tested and communities where people have insurance coverage. We know testing is available elsewhere, but people are not necessarily getting tested. So we've got to get that data to have a better sense of the magnitude of the problem in Shelby County.
And where did you do the testing over the weekend where you came up with 2%?
So that's all tests that were done. It's not tests that we do at the health department. It's that based on that number that we talked about earlier. It's all tests that were done. Could have been done at UT Baptist, a variety of facilities. It was everyone that was tested and reported in that 24-hour period. But you get the last one, okay.
And I know last week, Mr. Sweat was kind of, you all meet daily to get a sense of the hospital inventory situation. I know, I can't remember the word he used, I think it was manageable last week, or they were okay. I know y'all do this every day. As of today, how would you characterize kind of where we are in terms of space and availability? I know you're planning worst case scenarios, but where we stand
Right,
today.
so there's still beds available, it's still manageable, but we are seeing more people using ICU beds. So it is important that we're aware that people are ending up in the intensive care unit and more people are being hospitalized for COVID-19. So I'm gonna end with what I started with. If somebody thinks that they have COVID-19, if they're not sick enough to see the healthcare provider or be in the hospital, stay home. Take care of yourself like you do if you have the flu. If you need to see a healthcare provider, call first so that you don't expose other people. And if for some reason you need an ambulance, make sure you notify when you call 911 that clearly you need to be masked and so on. So we're going to end there. We'll be back tomorrow at 2 and just appreciate everyone being here and appreciate District Attorney Weier, Mayor Harris joining us, and also our sign language interpreter. Thank you.
Zip code analysis. What do you want to know? You want to know where they live or where they work?
I would love both.
There's still two kinds of maps.
That's based
On
on
all of them.
We don't have any maps now. What kind of maps do you want us to make?
I
You
would
wanna
make
know-
them. Give me the zip codes, I'll make them.
Zip codes of what though? Where they live or where
I
they
would
work?
love to know where they live, where they work, and where they were tested.
Or where they were tested? Well, okay. That's interesting.
Those
Okay.
three things I
Okay.
think would be fascinating.
Okay. I'm not sure. I'm not sure. So I don't
I
know.
think people ask me where they live. I think people want to know their neighborhood.
And that maybe
And then,
is
where they work is interesting because that's where the transmission is.
Right.
And then where they would
I want to put that out there. We're saying it's going to be made. Right. Because I want to stay
I think we'll see this out later.
I'm always saying testing information. The number of tests. I don't know what the number of tests is.
Well, you can't fix the problem if you don't know what the issue is, right?
That's the number of people that were have the illness. Right. The number of people that are tested is just an indication of panic, anxiety, or wanting to be tested.